Coming up on American Medicine Today, artificial intelligence is slowly being integrated into many aspects of our lives, including the field of medicine. Dr. Fahmi Farah joins us to discuss how AI could even help predict cardiac arrest. Then, Jim was suffering from terrible back pain, making it nearly impossible to stand or walk. After his GP referred him to the Bonati Spine Institute, he's happy to be back enjoying his cars pain-free. Finally, Dr. Bonati highlights just a few of the conditions he treats, as well as the overwhelming success he's had performing patented procedures at the Bonati Spine Institute. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. So a new artificial intelligence-based approach can predict significantly more accurately than a doctor if and when a patient could die of cardiac arrest. So will AI technology become the future of healthcare? Well, joining us to discuss is returning guest Fahmi Farah, medical expert and board-certified invasive cardiologist based in Texas. Welcome to the program yet again.
Thank you for having me.
Why don't you tell us about this new approach led by Johns Hopkins University?
Yes, it's a very exciting time in medicine. As you mentioned, it is artificial intelligence, a combination of engineering, artificial intelligence, science, and medicine at its best. So the promise is great. You're right. It does give us the chance to bridge a lot of gaps in medicine, especially within the field of cardiology, to pinpoint medication and treatment to a specific group of patients for the future.
It's been pointed out, some of the developers, from Elon Musk to some of these other companies, have said, let's put a pause on this because it could be extremely dangerous. So specifically when it comes to the world of healthcare, how is it they claim that it's significantly more accurate than a doctor? I just find that hard to believe.
I agree with you, actually, Ethan. I want to make one big clarification here. This new technology will not take the physician out of the picture. What it does do is it enhances the technology we have at the moment and gives us a lot more clarity into what can be done in terms of diagnosis and providing treatment that's more individualized to the patient. And I'm going to give you an example. Going back to this study, as you mentioned, is very specific to a group of patients who have scar tissue formed in their heart. So when we're talking about scar tissue, we really are talking about a very specific group of patients who have either had a heart attack in the past or they've had significant blockages in their coronary arteries that have caused them to have scar tissue in their heart. And this group of people are at significantly elevated risk of having cardiac arrest down the road. And so what this study did is that they're actually trying to create an algorithm where they can combine a lot of different variables that we are not able to take into account at the present moment. Variables such as their age, their race, their gender, what medications they're taking at the moment, their genetics, like their family history. So they combined a whole array of things, and that's where the individualization comes into picture, which we're not capable of doing right now. Specifically talking about a defibrillator, these people who are at risk of having cardiac arrest down the road, a lot of times these people we're putting defibrillators in them. Defibrillator, of course, is a device that we put inside the heart to prevent a cardiac arrest from happening. So what this technology does is that it allows us to be able to put it into those who need it most and not those who don't necessarily need it. So I don't think that this is better than a physician, but I do think it enhances technology in terms of what's going to be available in the future.
Quicker information and what they're claiming is more accurate as far as being able to look at all those variables faster than a human can?
That is correct. So they are promising a lot more information. So the gap that exists today, they're trying to bridge that gap so that we can provide more individualized care.
Would you agree? I tend to think that in the current economic climate that we all live in. The hospitals are experiencing staff shortages. There's not enough nurses. There's not enough doctors. So again, at least in theory, it seems like, it's another tool in the belt to use AI. But down the road and looking ahead, are we going to become too reliant on the technology versus the actual human touch and human intuition, that an actual doctor would have?
I think we're very much headed in that direction. It has its pros and cons. Like I said, the human element, at least in the near future, I don't see that being replaced. But in many other forms, we are becoming heavily reliant on technology and artificial intelligence. If you look at something as simple as telemedicine, for example, there's a lot of AI involved. There's a lot of technology involved. Even as simple as like a doctor's visit, before you used to have to go through a front desk person who's checking you in. A lot of that is automated now. Patients can actually fill out all their information on their own using technology. The whole check-in process has changed. So we're seeing little changes now within technology, but I do see that going like this in the future.
It's just you need that human interaction between doctor and patient. If it just becomes so sterile because it's AI, I don't know how that's going to fare for the patients.
I completely agree with you. I think there needs to be a very good balance between using technology as well as not taking that human element away. This technology or any future technology will not be able to take the physical physician element out of the picture, at least not anytime in the near future.
I would like to expand upon that, though. Do you, as a physician, do you see any other, areas of medicine, of health care in general, where AI could assist and be used? Thank you. I need AI to help me speak sometimes.
I do. I do see, and I want to make a clarification. When we're saying AI, artificial intelligence, that's a scary sounding thing. I agree with you, because that feels like it's completely taking over the human element. And it's not actually. It's just utilizing the technology to pinpoint things better. And that can be used in all areas of medicine, to be honest with you. And we already use some of those, like in surgical fields, for example, there's robotic surgery. And those robotic surgeries are still not taking the human element off, because the decision making at the end of the day is still within us. It still lies within the conversation of the physician and the patient. And that should never go away. So yes, to answer your question, I do see artificial intelligence being utilized in many areas of medicine, especially within the field of cardiology, because within all of medicine, including all surgical fields, cardiology really is one of the most high-tech fields. This is where you see most research being done. This is where you see most cutting-edge technology coming in. So if you see artificial intelligence being used anywhere, we'll probably be the first ones to use it. So it makes sense.
There's also still, with this, what is it, Chat GPT or something like that? There's an inherent bias they're finding with however this artificial intelligence was programmed. Of course, we're talking about politics and things like that versus, obviously you would hope somebody who's programming an AI bot or whatever that's going to assist in surgery or diagnosis and things like that, there wouldn't be an inherent bias, but there's a chance that it could still be there. What are your thoughts?
I agree on that as well. I think that all these artificial intelligence, they use neural network, for example, in the study that we're talking about. There will always be an inherent bias, because at the end of the day, it is being created by humans. So, nothing is going to be foolproof. Nothing is going to be 100% accurate. So at the end of the day, that human element is extremely important, and I don't think it's replaceable.
Neither do we. Thank you, Dr. Fahmi Farah, for being on the program.
Thank you for having me. It was so much fun.
Make sure you stay tuned. Coming up after the break, a story of recovery.
I went to Dr. Bonati, and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery, because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy, and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Visit askbonati.com.
I'm Jim White, and I live in Collegedale, Tennessee. I work in the utility industry. but my real passion is automobiles in the form of the Ford Mustang.
Jim's work and hobbies require him to be on his feet for extended periods of time, and it was becoming increasingly difficult to do either.
It actually wasn't an injury that I could have put a time date on. It was a gradual procedure, and it just began to ache and ache, worse and worse, and pretty soon I got to where I really couldn't do anything much. It was hard to walk, it was hard to stand, it was uncomfortable to sit. I couldn't bend over. We do about a dozen trade shows a year, and so I couldn't stand up for any length of time during those trade shows. It was just generally debilitating. Pain across my back, down my leg. It would take your breath away sometimes. Nothing seemed fun anymore. Didn't want to do anything. Your self-esteem begins to drop, and the lower it gets, it kind of has an exponential effect. It had changed my outlook on life. I mean, it was everything was dreary and a challenge.
Jim tried numerous conservative treatments to get him through the day, but nothing provided lasting relief.
I had to take loads of pain meds, and then I did the injections in the back. I did all kinds of physical therapy. Nothing seemed to, it would help for a short period of time, but when you get to where you're taking pain meds like it was popcorn, it's time to really move on to something else that was permanent.
Jim went to his family physician for help, and they recommended he contact the Bonati Spine Institute.
And he was the one that said, you need to check this out because I got good results and I believe you're a candidate for what they do as well.
Jim immediately called and spoke with a patient advocate. Hearing he was a good candidate for the exclusive Bonati Spine Procedures, Jim made arrangements and headed down to Hudson, Florida.
First they told me that, yeah, you're a candidate for what we do. I hadn't even told him, I hadn't opened my mouth yet about what my specific issues were. And he said, well, I bet you're feeling pain down your leg. I bet you're feeling pain across whenever you bend over. And so everything that he described, it was like he'd been reading my mail. He just knew what was there. We just loaded up the Mustang with our two little pugs and us, and we went down to Florida and stayed in a home nearby and put it all together, and the folks there were just wonderful with us.
Jim was amazed by the customer service experience he had while at the Bonati Spine Institute.
You know, you're used to when you're going to see a medical professional that you just sit and wait for a while. Boy, if you had a 10 o'clock session, they were there waiting for you at 10 o'clock. How they managed to do that is just was amazing to me. Just the way people treated you. It was, you felt like these people have my best interest at heart. Dr. Bonati was, you knew he was skilled, and when he would listen to you, he listened, it seemed like from heart to heart, not just from ear to ear, but from heart to heart.
The targeted Bonati Spine procedures are performed using conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure their source of pain was eliminated before leaving the operating table.
They had a monitor where I could see what they were doing, and to me that was just fascinating. I got caught up in it. It wasn't anywhere near as bad as the pain that I had experienced before the surgery. Of course, you get up out of the operating suite and you walk immediately. And that I found was way beyond what I expected. They thoroughly exceeded our expectations.
Jim felt so good after surgery, he walked into the recovery room.
When I got up to go to the recovery room, I could tell things were different. And then day by day, it got better and it got better, and it did it quickly. You know, I was back at work 2 weeks later, I guess, and then the next day, they had me out walking in the mall a little bit. Unheard of.
Now pain-free, Jim is back to work and tinkering with his cars.
I work full-time. I come home, I can keep up my yard, which I couldn't do before. I get to play with the Mustangs, which I couldn't do before. And I go to the trade shows that we go to, and I'm able to stand and talk to the clients, customers, and I just have a much fuller life as a result.
Jim encourages people suffering with neck or back pain to not lose hope. The Bonati Spine Institute can help.
If you think you've tried everything and you haven't been to the Bonati Clinic, you haven't tried what's going to work. That's what I would say to the person who feels like that they just are not going to get any help at all. It's worth the time, effort, and energy to get your MRIs done, have them sent down there, talk to them on the telephone, and just look at what other people have said. I met people from all over the world while I was down there. It just opens up doors that you thought were closed. It builds, you have a stronger relationship with your family. You have a stronger relationship and perform better at work. You enjoy the things in life that you thought were gone. Many times I would say, well, I'm just too old for that. Well, I wasn't too old for that. I was in too much pain for that. And by going to the Bonati Clinic and having them do their magic on my spine, you turn over a whole new leaf in life. You not only can do things, but you want to do things.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
And when I got up off that table, it was like, like a reborn again when I was able to walk off that table and walk out and go for lunch. I went in there at 10 o'clock, got operated on. At 12 o'clock, I was walking out on my own.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
This is the honest to God truth, and was recovering. I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody wasn't all like, "Didn't you just get out of surgery?" I'm like, "Yeah, I feel great." And like, "Okay, let's see how you do." And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. Why don't we talk more about what the Bonati Spine Institute does on a daily basis? I mean, you see people with stenosis, spondylolisthesis, spondy, herniated discs. How are you able to help those individuals?
One of the major trouble with the spine is the lack of a very clear diagnosis of what really is creating the pain.
Sure.
When you look at people that they come to see you, they also define like, I am in pain.
Yes.
But I am in pain means a lot of different things.
Mm-hmm.
One of the things can be a pain associated with the compression of a root that is totally different than the pain that is created by some type of arthritic changes.
Okay.
And totally different created by something that is invading or is creating a compression on the exit type of a root. And the people confuse those pains, and they confuse levels of pains.
Yes.
And when you assume that the pain is in the fifth nerve root, can be the fifth nerve root exit, or can be the fifth nerve root traversion.
Okay.
So if you operate in the traversion area of the fifth nerve root, one pain will go away, but the pain that is on the exit side is not going to go away.
Yes.
So the patient is going to come back to you, is going to say, I'm still in pain. When a patient goes back to a physician who did surgery and say, I am still in pain, confuse the hell of the doctor, because he believes that the pain should be gone, but at the same time, never check exactly what type of pain he treated.
Okay.
And then that confusion ends on a patient having another type of surgery. And sometimes the surgery is just directed to a creation in the mind of the surgeon.
Yes.
That pain is because the patient has an unstable back. And as soon as you create an unstable back in the patient, in the doctor's mind, the next thing goes the idea to do a fusion.
Correct. But there really isn't instability.
Instability is a hoax. There are certain cases of instability. If you have an individual who fell from a height and broke the spine and broke the vertebrae, yes, that is it's a real instability.
Okay.
If the patient had a spondylolisthesis that is mobile, that is instability. But this type of instability that they are trying to describe today in the journals is just a justification to do a fusion. One of the ways, for example, to check instability is to see an X-ray and then do a flexion X-ray and an extension X-ray and see if that area moves. Usually, they don't. And if they don't have any fusion, the physicians are trying now to explain something that is really a laughable thing.
And what's that?
They talk about an instability that we cannot see. So that is described in journals. And those journals are passing that information to the new generations that allows the physicians to do surgery when really is not instability.
Right. And we're hearing some real conflicting information about fusions too, that they're based upon fraudulent studies.
Well, all these things that happen when you have a confusion between a result of a procedure and that procedure is supported by the industry. Once you have an input on the industry that is being practically guiding the surgeons to do something because those gadgets are being developed to create certain type of results, but really those results are fictitious.
Okay.
If you have instability, you're going to see it. If you don't have instability, you're not going to see it. And just putting a note on the chart saying, this is a probably invisible instability, that's a joke. We don't do instability treatments.
Sure.
We don't do fusions.
Correct.
Because I don't believe on it.
What are you specifically doing at the Bonati Spine Institute with the Bonati Spine Procedures that's different?
Well, I developed techniques that they are very effective. These techniques are focusing in eliminate pressure of nerves in areas that they are pathways of the nerve.
Okay.
And it's the same thing that you have a tube, and through the years, you're going to bend the tube right and left and to one side and to the other side. You create inside of the tube different types of defects. Imagine it's a plastic rod. That plastic rod is going to just move in the direction of the defect, and it's going to create an indentation. And that indentation is going to create pain. The concept is simple and it's real. And that is why our results are so effective.
Yes, 98.75% patient-reported satisfaction. So it's not the industry that's patting themselves on the back. It's the patients telling you you're successful in relieving their pain.
That's correct.
Why do you think it is that you have such insight to the pain pathways in the body that other doctors really aren't paying attention to?
There are two different types of physicians.
Mm-hmm.
There are physicians that they just follow what they were taught on the school. Those doctors are like soldiers.
Right.
The order comes from the commanding officer, and that is what you are going to do. And you are not going to adventure, because adventuring immediately means that you are not following the rules.
Correct. So basically, because of what they've taught, they want the doctors to have blinders on and not think beyond what they've been told. And you were different.
I do things thinking all the time that is something better that we can do that is going to work better for the patient.
Yes.
I do this for the patient. I don't follow rules that they were put in place 40, 50 years ago. When we do hundreds of surgeries every month,
Thousands, yes.
then suddenly the experience is that to tell you, if you are going in this direction and this direction is not working, how about if you go in this other direction and see if that works? That is no institute or ambulatory surgery or hospital who has our techniques in any part of the world.
If you want to find out if you're a candidate for the Bonati Spine Procedures, visit askbonati.com. Make sure you check us out next week right here on Newsmax at 4 p.m. Eastern. If you have any comments or questions, contact us at the number below. Tweet at Dr. Bonati. For a previous episode, head over to Rumble and search American Medicine Today.